Hey everyone! Today, we're diving into a topic that's both exciting and a little nerve-wracking: labor signs. If you're expecting a little one or know someone who is, this is definitely for you. So, let's break it down in a way that's super easy to understand and hopefully a bit relatable. First off, let's talk about what labor actually is. It's that incredible moment when your body decides it's time to bring your baby into the world. But how do you know when that moment is actually happening? Well, there are a few key signs to look out for, and I'm here to help you navigate through them. One of the first signs you might notice is something called lightening. This is when your baby drops lower into your pelvis, and it can feel like a huge relief on your lungs and stomach. But don't get too comfortable just yet. While you might breathe easier, you might also feel more pressure down below. It's like your baby is getting ready for the big show, and trust me, they're not shy about it. Next up is something we all dread: Braxton Hicks contractions. These are practice contractions that your body uses to prepare for labor. They can feel like a tightening in your belly, and they usually don't hurt. Think of them as your body's way of saying, "Hey, we're getting warmed up here." But don't worry, they're not the real deal. You'll know when the real contractions start, because they'll be more intense and come at regular intervals. Now, let's talk about the infamous bloody show. I know, it sounds a bit dramatic, but it is really just a sign that your cervix is starting to dilate. You might notice some pink or brown discharge, which can be a little alarming if you're not prepared for it. But don't panic. It's a normal part of the process, and it usually means that labor is on the horizon. Speaking of dilation, that brings us to another sign: your water breaking. This can happen in a dramatic splash or a slow trickle, and it's often a clear sign that things are about to get serious. If your water breaks, it's time to call your healthcare provider. They'll want to know so they can give you guidance on what to do next. Just remember, it's not always a Hollywood moment. Sometimes it's just a little leak, and that's perfectly normal too. As labor approaches, you might also experience increased pelvic pressure or back pain. This can be your body's way of telling you that it's time to gear up for the main event. You might feel restless or even a little anxious. That's totally okay. It's a big deal after all. Just take deep breaths and remind yourself that you're not alone in this. Now, here's a tip. Keep an eye on the timing of your contractions. The classic advice is to head to the hospital when they're about 5 minutes apart, lasting for a minute, and have been going on for an hour. But every pregnancy is unique, so trust your instincts. If something feels off, don't hesitate to reach out to your doctor. Lastly, let's not forget about the emotional signs. You might feel a surge of excitement mixed with anxiety, and that's completely normal. It's a roller coaster of emotions as you prepare to meet your little one. Surround yourself with supportive people who can help you through this journey. So there you have it. A quick rundown of the signs of labor. Remember, every pregnancy is different, so don't compare yourself to others. Trust your body, listen to your instincts, and know that you're about to embark on one of the most incredible journeys of your life. You've got this.